Dr. Hazel is a member of the Board of Trustees of the American Medical Association. Dr. Hazel is an orthopedic surgeon in a private practice from Northern Virginia. He is here to testify on behalf of AMA, which is an organization that advocates in issues vital to the nation's health, and it is the United States' largest physicians group. Welcome. And you will have 5 minutes.
Good morning, Madam Chair, Ranking Member Chabot, members of the Small Business Committee and staff. I am Dr. Bill Hazel. I'm an orthopedic surgeon in practice over in Fairfax, Virginia, and a member of the board of the AMA, and I appreciate having the opportunity to testify this morning on small business competition policy. The healthcare marketplace has changed dramatically over the past decade, and frankly, the FTC guidelines have not kept pace. Current antitrust policies are barriers that chill physician collaboration and hinder our ability to participate in a full spectrum of healthcare initiatives. They've also perpetuated an imbalance in the market so that health insurers are able to force physicians to accept contracts that often impede optimal patient care. The healthcare antitrust environment has evolved in 3 significant ways. Number 1, current FTC policy discourages physician clinical integration efforts. The FTC guidelines and advisory opinions to date require a level of financial investment that is impractical for physicians in solo and small group practices. In other words, about 75% of physicians in the country. Number 2, widespread health plan consolidation has eroded the market and severely limited our ability to advocate for ourselves and our patients. In the last decade, there have been 400 insurer mergers. Only 3 were challenged by the DOJ. Only 3 of 400. And these mergers have benefited no one but executives and shareholders, and the proof is that premiums across the country have increased, out-of-pocket patient expenses have gone up, and physician payment has declined. The third issue is that professional market and regulatory developments are encouraging physicians to collaborate on the purchase and use of health information technology and quality improvement initiatives. Allowing a more flexible approach to physician joint contracting would address these market changes and, in fact, would be pro-competitive. Allowing physicians to jointly contract would increase competition in the insurance market. Creating physician panels is time-consuming and it's expensive. It can be a barrier to entry for new insurers. Through physician joint contracting, new payers could gain access to panels of physicians with wide geographic and specialty distribution. When the physicians themselves undertake the initial task of the network formation, payers may substantially reduce their cost of entry and expansion. Joint contracting would also lead to more equitable, better informed contracts. Most physician practices simply don't have the resources to analyze payer contracts. By pooling resources, we can spread the cost associated with analyzing these contracts and negotiate for improved contracts for our patients. Finally, joint contracting would allow physicians to create networks that would facilitate collaboration on health information technology and programs designed to monitor patient care and quality improvement that folks such as you are encouraging us to do even now. Acquiring, implementing, sustaining health information technology requires extensive financial investments by physicians, but the Congressional Budget Office has documented that health insurers are the entities that benefit from cost savings associated with these systems. Allowing physicians to negotiate jointly with payers will help us reallocate these cost savings appropriately and pay for the services. Similarly, many physicians lack the ability to participate in quality improvement initiatives. By teaming up in networks, small and solo practices can gain the scale necessary for care coordination and appropriate data aggregation that allows us to implement these initiatives. Now, current antitrust policy is clearly out of step with the changing healthcare marketplace. It has led to overly aggressive of enforcement against physicians in certain cases, limited opportunities for physicians to collaborate in other cases, and it has permitted unfettered health insurer consolidation. The FTC must update these policies. As the chairman indicated, we are currently discussing with the FTC the guidelines on physician joint contracting, which we believe should allow small practices to collaborate on health information technology and healthcare quality improvement initiatives. Furthermore, the DOJ must challenge health insurer mergers more aggressively. These steps would restore balance to the healthcare market and ensure an innovative and efficient healthcare system. Thank you, Madam Chair and members.